Nakitlong ka Ri Khasi. Ngiwan lam shapi ko sngur bakhuit parpashngam. Ka beats aqua. Shpausnem dang yai pinja sliang.
Ka East West Group of Institution Bangalore, ka Cot Admission nakamta ka Nursing but Paramedical Course, ka bala ithu da ka Indian Nursing Council, ka by admission ka badunatam, but shispa % ka jingyokam. Pila ru ban apply da ka education loan.
Ka Apollo Multi Speciality Hospital Kolkata, ka Lapanlong ka jing panchai paid ba, halor ka Rukam Sumar, haka ba Lapanlong ka jingyatai, hakuhati, da ka bapanle jingmut karpang. Kapag ka Jingsumar, haka jingpang, bampong hakali, bat rendang, robotic surgery, gastrointestinal, oncology, bat liver, transplantation. Ya ka jingya thir layalam do Dr. Rajiv Sharan, senior consultant, haka onco surgery. Kapag jong ka Jingsumar, ka khali, bat rendang, jong ka Apollo, Multi Speciality Hospital Kolkata, bat u Dr. Ramdeep Ray, ukhli, ka liver transplant and senior consultant, Hakabay kilay karenru, shikila pathay Khubor, halor ki Rukom Sumar, katkum kaniga juk menta, hakathay Northeast. Hakaniga jingathir, u Dr. Rajiv Sharan, ulamad phang, baka jingpang, bampong gakali, bat urundang, kidegi bakan ray bha India, khamtam ha Northeast. Ulong ba, ka jingbam kway duma, tan sikret, bat ka jing dikyat, kabayalam shika jingpang, bampong. Ka Apollo Multi Speciality Hospital Kolkata kan beteng benthaw kilat ke linti ban ay ka Jingsumar ka bapakatam hakabay day bat kani ka jingpang bampong. Nakalyang u Dr. Ramdeep Ray ulong baka India kade ka way ni kiri ka balam khmat hak Jingsumar yuksang ni liver transplantation hendre kadang suki habapay ha Northeast. U Dr. Ray ula banjur ya ka jingdon kam ban ay ka jingban shay ka bapura Shikipad by Yaka Jingdon Kam Ban Sinyang Department, Ban Pitnim Yaki Bashitom, Yaka Apollo Hospital Enterprise Limited, Lapli do Dr. Prathap C. Reddy, Hachanai Housenem, Katkindai Spa Prapulai, Badmanta ka Apollo Kadei, Kabaheatam, Ban I Jingsumar, Bandon, Shipua Jartali, Jaintia, Haki Nyo Pulai Tali, Ki Hospital, San Hajar Sanspa Tali, Ki Pharmacist, Bad Palat Arspat Ligi Clinic, Bad Diagnostic Center, Bad Palat Nyo Spatli, Ki Telemedicine Center.
So they both are here for the center. With that, they will be also having a scientific. So they will be sharing their. And we started in 2003 at Kolkata, and it's a hospital where we do for Sir's department from endoscopy to liver transplant, and for Rajiv Sharan Sir department from chemotherapy, radiotherapy to surgery to hemato-oncology to bone marrow transplant. Everything is done under one roof. So the beauty of the organization is as such that any patient who comes with multiple problems can be managed under one roof.
Consultant in head and neck surgical oncology department in Apollo Calcutta. So head and neck cancer is one of the most common cancer in India, and especially Northeast has a huge burden of head and neck cancer. So why head and neck cancer is so common? Because people here use tobacco in different form. So either smokeless tobacco or it's smoking and alcohol. So these are the factors and leading to almost 80 to 90% of all head and neck cancer. So head and neck cancer is not a death sentence as such. It's a preventable cancer. So if you decrease tobacco consumption, head and neck cancer incidence will come down, significantly come down, because that is the cause of head and neck cancer. Apart from tobacco use, HPV cancer also common in this region, especially for pharyngeal cancer. So people should be aware about the causes of cancer, and then comes prevention. So prevention is possible by decreasing use of tobacco consumption, alcohol consumption or HPV vaccination. And then comes early detection, because problem here is most of these patients present very late stage. So at late stage, treatment options are limited, treatment options are complex, patient will require complex surgery, plastic surgery, reconstruction. Apart from surgery, patient will require radiotherapy, patient may require chemotherapy. And if disease is not operable, in that case, patient may require chemotherapy, targeted therapy or immunotherapy. So those are very costly treatment. And even after so much cost, patient function will be compromised, patient cosmesis will be compromised. To prevent all these, if people are become aware about the early symptom, so that include any oral ulcer that is not healing in 2 to 3 weeks time, any oral white patch or red patch, patient has difficulty in swallowing, patient has throat pain, persistent throat pain, patient has persistent ear pain, patient has neck swelling, patient has thyroid swelling. So patient should not ignore these symptoms. So if these symptoms are there, then patient, and these are persisting for more than 2 weeks time, then patient has to be evaluated by a specialist. Treatment is just single modality treatment. Patient can be cured with just only surgery or just only radiation. So toxicity will be very less, patient function will be preserved, patient cosmesis will be preserved, and patient prognosis will be very good. Cure rate will be as high as 80%, 90%. But if patient ignores the symptom, then that becomes advanced lesion, and mostly from patients from these areas, northeast region, they present very late. So at that point of time, treatment is complex, as I mentioned earlier. Patient will require 10 hours surgery, 8 hours surgery. Patient will require radiation. Patient will require chemotherapy. Even after such complex treatment, prognosis will be bad, maybe 50% or 60%. But still, head and neck cancer, even with advanced stage, treatment is possible, and still that will be 50 to 60%. So now our goal of cancer treatment is not curing the disease only. Cure is obviously the most important goal for head and neck cancer treatment or any cancer treatment. But apart from cure, patient should also have good quality of life. Patient speech should be preserved, patient swallowing function should be preserved, or patient should have access to good rehabilitation services, good dental services. So all these factors are important. So also now a lot of young people are also having cancers. Especially thyroid cancer is a disease of younger female, and their treatment is like you give a big scar on the face, in the neck. So to avoid these scars, to make surgery less complicated, with less complications, now options of robotic surgery is there. So in robotic surgery, you don't give any incision in the neck, so that can't be visible. So you do from chest or transoral or from behind the ear, so nothing will be visible to others. So young patients, these are very good options. Patient goes home maybe next day or day after tomorrow. Patient will have less pain, and in robotic surgery, that gives 10 times magnification. So each and every structures we can identify and preserve, and that gives very good function, good cosmesis, and with good cancer oncological outcome. So My advice to people here in Meghalaya will be to decrease tobacco use in different forms, all forms, decrease alcohol consumption, be aware about HPV vaccination because pharyngeal cancer is quite common. And if you have symptoms, then don't ignore those symptoms. You go to a specialist, get investigated, and accordingly you take treatment so that your cancer should be detected at early stage, and at that point of time cure rate will be very high, patient will have good function, patient will have good cosmesis, patient will have good quality of life. So head and neck cancer is not a death sentence, it's a preventable cancer, and if it detected early, then can be cured in majority of patients. Facilities over Meghalaya has improved over whole of northeast region, even eastern region. Kolkata was also previously lagging behind, but now with good centers coming up in different part of eastern region, especially Kolkata, so lot of progress have happened. So similarly Shillong has good medical facilities now. So, but people are still not aware about those symptoms. Patient try to avoid going to a doctor. They don't accept that they have a major problem in their body. So until unless they become aware about those symptoms, as I mentioned, those are symptoms of head and neck cancer. So if they are aware about those symptoms, then obviously they will go to a specialist and get evaluated. So that is your duty, media duty, to spread awareness so that these patients can be detected at early stage. So now lot of doctors also previously they were not that much aware about these symptoms, but with awareness campaign and all, they will be aware. So people will be aware. And that this awareness program will lead to early detection of cancer. So if facilities are not here, in that case, obviously that facilities will be coming in future in different centers here itself. But modern treatment facilities may take time here, but that is also available just closer to northeast, that is in Calcutta. You don't have to travel to south, Chennai, Bangalore, Delhi, Bombay, because everything is available in Kolkata now. So because that is, as Dr. Ramdeep mentioned, that Shillong is just only 2 hours away from Kolkata. So gradually, like one center, if eastern region develops, then obviously surrounding first main one city, if Kolkata develops, then gradually that other cities will also develop. So gradually that modern treatment will come to each and every city of northeast as well as eastern India. For around 80% of cancer, I didn't tell 100%. So 20% may be from different reasons. So one important reason for if you take oral cancer, so just not only tobacco, if you have frequent oral bite, if you have frequent tongue bite or cheek bite, that can also cause cancer, because there also inflammation happens repeatedly and that can transform those cells into cancerous cells. So if you have frequent oral bite, tongue bite or cheek bite, then you have to go to dentist, and that sharp teeth should be grinded properly so that again that can, same injuries should not happen again. So those are also important. And apart from this, there is a vital origin of cancer as well. As I mentioned, HPV, that is human papilloma virus, that is also one of the main reasons for pharyngeal cancer. So in plain area, if you see other part of India, pharyngeal cancer due to HPV as such, that is not very common, maybe around 15% or 20%. But in northeast region, that incidence may be higher. In western countries, if you see pharyngeal cancer, almost 80 to 90% is due to HPV. So in northeast region, that incidence is also becoming similar to what Western countries are having. So apart from these, alcohol also that can cause cancer. Supari use, because here as I come to know that here they use fermented supari.
Well,
Quite. So that is also important reason for cancer. If you use repeatedly, then that can cause some mucous fibrosis, and that will lead to oral cancer as well. So tobacco is main. Tobacco, supari is main culprit. Alcohol is also causes head and neck cancer. So these are the common causes of cancer.
Now, and liver transplant in all centers who are doing liver transplant regularly, the success rate is around 90%, which means 90% of the patients will go back to leading normal lives. It's not as if they are going to be staying at home all the time. All patients who recover from transplant go back to work, go back to their normal activities. Even the people who are younger, they can go on to have children, leading normal family lives, everything. So yes, 90% chance of success, but the problem is awareness. People don't come at the right time. I think the doctors in Meghalaya, in Shillong are amazing. Some of them have trained with us, some of them have we have worked with, and we see they are brilliant. And nowadays most of the centers have all the equipment that is required to make the diagnosis, but the problem remains that patients reach the doctors late. The service is available, but patients are not reaching the service at the right time. So once all the patients who have the disease are diagnosed in the early stage, then there are some treatments, most treatments will be available in Shillong itself. Some high-end treatments will not be possible in Shillong, for which people need to travel, and that also needs to happen at the right time. When we talk about cancer, very often people use the term loosely, saying, I have cancer. Now, someone who has a thyroid cancer, papillary thyroid cancer first stage, is a very simple disease which is expected to live for decades, normally. But someone who has an advanced pancreatic cancer or an advanced gallbladder cancer, which has spread, if he's not treated at the right time, he will die within 3-4 months. So, the word cancer, we use that to refer to everything, but we have to start talking in terms of the type of cancer. So some cancers, the results are very good. Some cancers, the results are very bad. Now, among the type of cancer, a stage 1 cancer and a stage 4 cancer are completely different. So, if I have a cancer, for example, if I have a colon cancer, or if I have a prostate cancer, or if I have a papillary carcinoma of the thyroid gland, and if it's picked up at the right stage, then most probably I will never die of that cancer. I may die of other things. I will go on to lead normal lives. But a stage 4 cancer sometimes can be very bad. So the responsibility that I have, that every person has, is because we have access to internet, we have access to media. We know there is something called cancer. We know everyone is telling that you have to pick up cancer at the early stage. So when someone is having certain symptoms, for example, patient is having a lump anywhere, a swelling, patient is having a patch, a new area inside the mouth, on the face, on the skin. If someone is having bleeding in stool or vomiting of blood, there was one patient who I saw today. She's completely okay. But what she said was, she went out. I had completed my prescription. She went out and then came back and said, Doctor, one thing I forgot to tell you. My weight was 75 kilos in December and it is now 67 kilos. I have lost 8 kilos of weight. Are you sure? She said, yes, my clothes have become loose. So there is a clear proof that she has lost weight. And immediately I wrote out a number of tests because unexplained weight loss. I'm not dieting, I'm not trying to lose weight, and my weight is going down and down. That must be investigated. If someone is having constipation always for many years, and that person suddenly has diarrhea, repeated, going to the toilet again and again, this is called a change of bowel habit. Or someone who goes to the loo, to the toilet 2 to 3 times, passes 2 to 3 times, many years, and says, now suddenly I have constipation. We are worried this may be a cancer of the colon or the rectum. So these warning signs, jaundice, yellowing of the eyes, okay. So any swelling anywhere in the body, any new patch anywhere in the body, any vomiting of blood, passing blood in stool, black stools, jaundice, unexplained weight loss, and lastly, loss of appetite. Not feeling hungry, looking at food but not feeling hungry. These are the warning symptoms, and we have to, we need to be good doctors, for which we need to do certain things. And there is a saying that we also need to be good patients. How can we become good patients? By following doctor's advice, by doing the things that the doctor is advising, and also to reach medical care quickly when these warning signs are there. And this is going to save lives. Preventing or detecting early will save more lives than fancy complicated treatment.
For example, I have told you about the warning signs of cancer, and some of you may forget it. Now, 6 months later or 6 years later, you may remember that he had said there are certain warning signs. So you go to Google, type in warning signs of cancer or warning signs of oral cancer. Then you get to see, do you have that? Great. So the first part of your question, that people read from the internet, they get information from the internet, they even try to make a diagnosis on the internet. Nothing wrong with that. That's brilliant. We have to encourage people to do more of it. You come up saying that, I think I have appendicitis. Great. It may be wrong, but at least you think it is something serious enough to go to the internet, check, and then come to a doctor. And the doctor may tell you, you don't have appendicitis, but you have some form of a colon tumor. So you thought appendicitis, but you came and were diagnosed as colon cancer. So ultimately your Google search, although wrong, helped you. Problem is the last part that you asked. Self-medicate. That is not okay. Self-medication has to stop. And even before the beginning of this internet thing, patients in India are dying regularly because of self-medication. They are not dying because they are taking the medicine. Someone else is dying because of the medicine. So, India is the antibiotic resistance capital of the world. Antibiotics are not working. Reason for that is we take antibiotics without even consulting doctors. We just take it, and what that does is you have an infection and then you don't complete the course of antibiotics. So what happens if there are 100 or 1000 bacteria in your body, you take a wrong antibiotic, or you take half the course of antibiotic, and out of those 1000 bacteria in your body, 900 die, 100 live. Which 100 live? The bacteria that are strong, that are resistant. Now what happens? The weak bacteria will die off, the strong bacteria stays, and then they grow, and they then infect someone else. They go on to another person's body, he takes wrong antibiotics, shorter duration, he has 1000 bacteria, 950 die, 50 live, the strongest bacteria. So what are we doing? By taking antibiotics, we are keeping alive the stronger resistant bacteria and passing it on to our neighbors. And to add to this process, we are giving ciprofloxacin tablet to cows and animals. This is a big problem, that people give ciprofloxacin tablets to animals along with the food so that they don't have infection. And the same thing happens. So now in the soil, in the water, in the surroundings, there is bacteria which have become more and more dangerous as they have been half treated in humans and animals, and so we have resistant bacteria. And so the infections that we happen, that people in India are getting, and the infections people in say Norway are getting, they're very different. We all have resistance. So now you need stronger antibiotics which are more expensive, antibiotics which cannot be given at home, antibiotics for which we are hospitalized. So antibiotics kill more patients in the long term. I had the liver transplant program. I was earlier at Apollo Delhi, Gurgaon, and then I started in the last 4-5 years at Kolkata because I wanted to come back to my hometown and start a liver transplant program. And Kolkata is now the only place in the entire East and Northeast India where liver transplant happens regularly. जहाँ हर समय liver transplant हो रहा है ऐसा एक शहर. Whereas पूरे इंडिया में बहुत सारे liver transplants होते हैं. Now, the most significant medical development that has happened in Shillong in the last few years, the biggest medical development is the opening of the airport. So now the distance from patient who is unwell to Kolkata is less than 2 hours. So this changes everything for Shillong. If the patient has a major, for example, a patient has a liver failure, sometimes the patient needs a liver transplant in an emergency. Now, earlier the patient would take almost 10 hours, even if from here to Guwahati and then by flight. But now that has become, you are within 2 hours of the most modern medical care that is available anywhere in the world. There is no treatment in our hospital, there is no treatment that is not there. Any treatment that is there anywhere in the world is there, and it is done by open surgery, by laparoscopic surgery, by robotic surgery. All options are there. But still, the problem is now awareness. Awareness that this advanced medical care is there, is affordable, because sometimes the patients can afford, sometimes they have insurance, sometimes there's government funding, and then after that there are patients which there is NGO funding, where it is possible by internet support, social media, crowdfunding. So that all support is there. What is important is that the patient reaches us at the right time. Now, alcohol remains a big problem in the Northeast. And in other places, fatty liver disease is a big problem. Fatty liver disease becoming severe liver cirrhosis requiring transplant. So, in Northeast, we have both alcohol and fatty liver disease, which lead to cirrhosis, and the treatment of cirrhosis is liver transplant, which now has a 90% chance of success. At the same time, cancers are increasing, and cancers in the tummy, पेट के अंदर जो cancers होते हैं, stomach, colon, intestine, pancreas, liver, gallbladder, ये सब cancers we treat regularly, and उसका भी operation by open surgery, laparoscopic surgery, robotic surgery happens regularly. So the only obstacle that is now there is awareness. People need to know that treatment is possible, and that is why we are here to reach out to the patients of the Northeast of Shillong, and so that they have access to advice and then they can plan treatment.
Every morning in our house begins with a race. Shoes, slippers, everything on the ground. Mom shouting for breakfast. Dad's hunting for geese. And I'm in a hurry putting on my socks. Shillong's roads are always full. Honking cars, parents rushing, everyone trying to reach somewhere first. Then one day, the STEM's bus came to our lane. Big, bright yellow, like sunshine on wheels. The bus is always on time. Arcadica waves, It feels like family arriving. Inside, it's not just seats and bags and uniforms. It's laughter, stories, songs, small little friendships growing every morning. We share snacks, help with homework, and learn to wait for each other. I think that's what community really means. Caring for people who share your road. When I see other parents dropping their kids one by one, I think, wow, if one bus can take 50 of us, that's 50 cars less on the road. My father says the bus helps save money because it's not just fuel we're saving, it's time too, and time matters. And my mother knows exactly where I am, every turn, every stop, all thanks to the STEMS app on her phone. The bus feels safe, clean seats, big mirrors, and a careful driver. When a new student comes in, we always make space, and by the next stop, we're already laughing. When we reach school, our caretaker walks us right to the gate. And after school, the caretakers are always waiting, smiling as they walk us back to the bus. The caretaker feels this bus has made life easier, but to me, it made life a lot more happier. Because one bus doesn't just save money or time, it saves mornings. It gives us cleaner air, calmer roads, and families who can breathe a little easier. I think our city is growing smarter, not faster, just kinder. And every day, this bus carries something more than just us children. It carries stories, friendships, dreams, the small moments that slowly becomes memories, and carrying a little bit of Meghalaya's heart with them. Every day, as the bus doors shut and the engine hums to life, I take a quiet moment to be grateful for the journey, for the care, and for everyone who makes it possible. This is STEMS, our ride, our happiness, our tomorrow.